The way PiezoWave works is it sends an intense sound wave deep into the tissues. We can control the depth of that with changes to the setup of the machine. So we may choose a different setup based on how deep a tissue we want to target. So the sound waves that go in, not exactly like people think of with a traditional ultrasound. It's been used in physical therapy for years, and which we do still use. But traditional ultrasound is a gentler treatment. The patient doesn't feel a lot during it. This is a more intense sound wave, different waveform that when the patient does get this driven into their tissue, they will feel it. They'll feel typically a deep ache. We can control the intensity of the machine to make sure that it is not too intolerable for the patient, but it can be intense at times. The technology is not unlike lithotripsy, which is what is used to break up kidney stones. Same technology, just a little bit lower energy. The idea is the sound waves go into the tissue and create a compressive event, which can cause healing of tissue, can stimulate healing and recovery. It's a great modality for pain management, and unlike traditional ultrasound, it really creates a more mechanical effect. This compression event that happens deep in the tissues is more like a deep soft tissue manipulation, deeper than our hands can reach. So a very mechanical effect that happens on loosening up tissue and improving soft tissue mobility, that type of thing. So it's something we've been using quite a lot. Our patients have been getting great benefit from it, and it's available for you right here at Orthopedic Rehab.
Well, I said the surgery in the shoulder went pretty good. Everything was doing good, and when I started doing the physical therapy, I started feeling it just wasn't right. I was feeling more pain in my elbow area, and I said we came to the conclusion, or like Josh did, that it was maybe tendonitis setting in, and it was pretty uncomfortable. I mean, I wasn't feeling any pain in my shoulder. It was down near my elbow, which kind of concerned me, but after the first treatment of this, we did it on a Friday, I think it was, and then it felt a lot better over the weekend. And then we did it again the following Monday, and it did really good all week long. And I think that after the third treatment, I've had 3 of them done now, and after that, I haven't had any issues at all with my elbow. It's pretty much went away.
Initially, I was shocked. I mean, because they had tried, all the other stuff was helping, but it was a dramatic result almost overnight. They did PiezoWave in the afternoon. In the following morning, I was like, I'm like almost 100% better. Yeah, it got to the point where I couldn't even put bare weight at all on the foot, and it would almost bring tears to my eyes. And then it was such a relief to, figure out that I didn't, originally I went to the podiatrist thinking I would just get a cortisone shot and everything would be better. But because of some health conditions, he wouldn't do that anymore. That was no longer an option for me. So I started out here as a real skeptic. I'm like, I don't know if this is going to work. and now it's amazing. I mean, I'm just about 100% right now.
Well, coming in, I couldn't get it past, like, here. And she suggested trying this. And I wasn't quite a believer in it, but she did it, and by the time we got done, I could move it up to, like, here. This is the 4th session. And I've got all the movement. I've still got pain, but I've got all the movement. The movement this way, I was fine. It was extended out this way.
But now you can do that.
Now I've got
with
full
that
motion
shoulder.
with just as I do with my left.
Wow.